This is the latest heart update after the leak closure device was installed, in addition to some really hard lessons about heart medications. In the last video, I was just getting ready to go into the hospital again for a paravalvular leak closure procedure, which was last Tuesday. I really didn't think I'd be there more than maybe one overnight, which Barron is usually good for that. But I thought just in case, I'll have the neighbor kid come over, show him where the food is and treats and how to walk him and everything. And I'm very glad I did, because despite the procedure going fine, and I would have been able to get out Wednesday after they did the echo that morning, because of the catheter complication, I didn't get out until late on Saturday. And I've got another whole video I just put out on the catheter issue. While in the hospital, the cardiologist NP came by to check on me the next couple of mornings, and I asked her if I should be feeling as bad as I was. Now, granted, I hadn't been doing any exercises. I was pretty much just laying there, but I had no appetite, I had no energy. I was pretty much just laying in bed through end of Thursday. It wasn't until Friday morning I started moving a little bit. She did say that, yeah, it's going to take a while to heal because of the lattice issue, right? So even though, just as a reminder, the valve you have here, you've got the outside ring and you have the valve in the middle, and the tissue was tearing at 5 o'clock and from 7 to 9 basically. And so that closure device that they were putting in over here, again, that is like a lattice, right? And the heart tissue cells have to grow over this to completely seal it. So in the time where this is being sealed with tissue, then yeah, it's going to take 4 to 6 weeks, whatever, for that whole thing to heal. But what didn't make sense to me is we didn't actually cut on the heart anywhere. We just inserted a plug. So why do I feel worse now with my breathing than I did before the procedure? While I was in the hospital, I just felt ragged out. I didn't even have the ambition to open the laptop until mid-Friday or so, just laid there sleeping on and off. The first full day back home, I took Barron for a walk that morning, and even one little walk around this block, I was beat. Getting up, I felt lightheaded, a little bit unstable, to be honest, and just weak. Slow walk, having to stop every 2 feet for him, was still just really wore me out. Because of how bad the breathing was, I got out the O2 sensor to check my oxygen levels, and they registered as normal, so that wasn't the cause of the problem. The next big adventure that day was, as soon as the pharmacy opened on Sunday at 10 a.m., was to go try to get the medications. Now, they had prescribed 3 medications while I was in the hospital. I was not on any of these before the hospital. They prescribed them and started giving them to me in the hospital. And so I assumed that they would be waiting for me at the pharmacy, went in there when they opened. There were 3 medications that they added while I was in the hospital. The first one is plavix. And plavix is basically there as a blood thinner. And the reason for that is because while this implant is in the body, it shows up as a foreign entity. So the body wants to naturally coagulate the blood to this device. But if you do that, then those little clots that can form there could break off and go up to the brain and cause a stroke, which is bad. So we take plavix for 6 months or so after a procedure like this to keep the body from coagulating blood to it. And at that point, you then have all this healthy new tissue on the device, and the body will accept it as just tissue. The second one is one that we've talked about before, called farxiga. And farxiga is originally created for diabetics and something that would reduce the mortality risk, but they've since been using farxiga for heart failure patients as well. They found that it improves the mortality it also may slow down the degradation of the ejection fraction. It may not make it increase, but it might slow down the degradation. So that was one they added. The third one is entresto. And entresto is something that's also for heart failure patients. What this does is it's trying to make the heart work easier so that it can hopefully build back up and increase its ejection fraction. So the farxiga operates on, let's just put blood thinners here. Let's put reduce blood sugar, and this one operates, or at least in part, in reducing blood pressure. That's just one of the ways it does it. So this one again is a risk mitigation for stroke risk here. These two are both about trying to lengthen my time and quality with respect to heart failure. As far as the entresto goes, one of the nurses that I had in the hospital, whose former cardiology and cath lab, her husband actually was on entresto after a heart attack, and she said that she felt that this was one of the key ingredients to helping him go from around 30s to 40s with his ejection fraction after the heart attack. The reason this topic came up is because on Thursday night before my bladder procedure, my blood pressure had gotten so low, it was around like 95 over 50 something. It gotten so low and that they had to give me a different drug to increase my blood pressure so that I could even have the procedure on Friday morning. So in talking through this with her, she said, well, entresto does lower your blood pressure. That's part of how it makes it easier for the heart to work and help build back its strength. We talked about how low is too low a blood pressure, and what she was saying is, you know, if you're at like 90 over 50, that's a concern. And I was just a little bit over that. She also made a comment that basically what you do is you take the, whatever your number is, let's say it's 90/50, take 90 plus 2 times 50, right? And that gets you 190. You divide that by 3, and you get 6, 18, 10, 63 and change. And she said basically, if that falls under 60, this number here, then that's quote unquote bad. However, having gone through what I have this week, I now know that you can be in trouble a lot more than this too. She did make a comment that if my blood pressure was getting too low on the entresto, she really felt there's value in taking it, but she said that maybe what they'll have to do is look at a reduced dosage to make sure that I still stay at a healthy blood pressure. Okay, so now that we covered the medicine details, let's go back to, I get to HEB trying to pick up my meds. They don't have anything. So I think what happened is, because I didn't have a script for any of these coming into the hospital, they were all issued while I was in the hospital. They were giving it to me. And so somehow a link got broken. Maybe it's because I switched hospitals in between during my stay, but basically they had not gotten to the pharmacy. Fortunately, even though it was a Sunday, I was able to call the nurses station at the floor where I'd been in the hospital. They had a doctor call over to the pharmacy, and within a couple hours I had the 3 medications. As if that wasn't enough, these 3 medications were over $1,200 for the 3 of them. I guess it costs money to be sick. I appreciate the fact that I have good health care and I was able to get the treatments that I needed, but $1,200 really stings for several medications. I'd never paid anywhere near that. I confirmed with the pharmacist that this was using my insurance, not somehow there was a glitch or the insurance changing hadn't messed something up. Just astounded with what that cost was. Throughout that day, Sunday and Monday, I tried to, again, take Baron for a walk in the morning, do a little bit around the house. I still felt horrible. In fact, this is the worst that I've ever felt in my history with heart stuff and that. Now, I'm not on oxygen, no, so maybe after the first heart procedure, maybe it was a little worse, but I think it would be comparable to when I had that 8mm hole in the upper septum. A few years ago, this upper septum had an 8mm hole in it, which basically meant the heart was not the most efficient pump. And at that point, I was struggling to stand for a whole shower. I'd have to finish rinsing my hair on my knees sometimes, but I was still going to the gym once in a while then. There's no way I could do that now. Just going for a drive, I felt like I shouldn't be driving, like I was drunk. I would have no reaction time, short of breath doing anything, getting out of bed, walking around the house, walking into a grocery store, just miserable. And this is definitely not how I want to be living. I had a checkup with the NP on Tuesday morning, which was 1 week after the procedure, and I explained through to her. Felt like I was drunk trying to drive over here. I can't breathe doing just walking around. I had to catch my breath in the doctor's office, and I walked downstairs, not up them. So I said, this is really bad. So we kind of talked about the history of, say, the ejection fraction. So if we think of last fall where I was at 41% ejection fraction, that's where I was about Texas mile time. And then at some point between October and let's say December, it went down. For sure, my breathing got way worse, and in January or so, we saw that it was like in the 30 to 35% range. So it dropped down to here. And even at that, it wasn't pleasant, but as I lost weight, the breathing got better, and as I was eating less and being smarter about my habits, that got a lot better. And so what didn't make sense is why now in June out here, why do I have this procedure that I would have thought, and as I explained to the NP, I said, if 41% is what I felt back here, and then I dropped, I assumed that this drop was a result of this leak over here, so that now that we've fixed that leak, why wouldn't I be coming up here again to around that 41%? And she said, well, you should feel at least as good as you did before, and then eventually over time, get back up to there. And I said, well, that's not what's happening. What feels like is ejection fraction aside, if I just think of this as breathing, how I feel, I felt okay here. I felt not great here, but I feel like I'm down here at this point. It is drastically worse. I asked her if she thought the entresto was dropping my blood pressure enough to cause how bad I was feeling. And she said fairly confidently, yes, that's probably what's causing it. I said, look, I'm about ready to throw this stuff out the window because I don't know how much time I have left, but what I definitely know is that I just got a procedure that should make me feel better. I'm feeling way down here, and this is not the quality of life that I'm going to be happy with. I would rather throw that stuff out the window and feel like this somewhere in here for some period of time versus feel like this for any amount of time, because it's just not worth it. I also asked her if things like farxiga and entresto, if they operate on, let's say you have a patient with blood pressure and blood sugar, and let's say that here's healthy levels, and they have high blood pressure and they have high blood sugar, and you give them these drugs here to reduce them. Well, what about somebody like me that started good, right, here, and now you're going to reduce them? That means I'm no longer good anymore. So how do I know, since I'm not what we consider the average patient, I am not an overweight diabetic who drinks and smokes. That's not me. I'm very active. So, and I have normal healthy numbers besides this whole heart thing. So how can we begin to expect that these drugs are going to have the same effect on me as they do somebody who's in really poor health? She did say that really what they wanted to do is they started me on the lowest dose of entresto, and they wanted to see how I did, and if it was all fine, then they would increase to maximum dosage because of where I am in the heart failure path. But if I can't even handle the low dose, I sure am not going to be able to handle a higher dose. So she said, do me a favor, go home and track your blood pressure for a week. And if you still feel this bad, your body hasn't started to adapt to it, then call the doctor and talk about some other options. Maybe I know people that have gone from entresto that had problems to other cocktails, so there may be other options there. I agreed to it. On the way home, I bought a high accuracy blood pressure cuff to manage it. And as I sat here at home feeling horrible, I realized I do not want to spend one more day feeling this way. I need to make the most out of every day I have left, and this isn't it. I also thought, well, what if a week goes by? Then what's that mean? So let's say that right here, this is how much I'm feeling bad from the entresto, right? Well, what if in a week they look at it and say, you know what? Your body's adapted halfway to it. And you know what? We'll put you on a half dose, which isn't what they want, but okay. Well, what does that mean? That means I'm still feeling like garbage here, worse than I should. I want to be feeling up here as best I can for as long as I can. The other aspect is the scientific point of view. We have 3 variables, right? I mean, I kind of know the plavix, that's okay. We did a procedure, we added this drug, and we added that drug. So if I feel terrible, well, which of the XYZ is contributing to that? We think it's the entresto, but maybe it's the farxiga, maybe it's the combination of them. We don't know because we have 3 variables. And if I felt really great, we wouldn't know either. So I would rather take me off the drugs, let my body naturally heal after this, see what the injection fraction does, and then let's make that my baseline. So maybe I come back up to 40% out here in the future. Okay, well, 40% is where I am without the drugs. Well, then we have a data point. We know that's where I am. Then we can try drugs, maybe farxiga or something, and see, hey, does it help? Does it make it worse? We just don't know. And that's the problem is, yes, we want me to be healthy, but when you throw 3 new things at it at once, you can't separate the effects of the 3 items. So this morning, waking up, I still took my plavix, which is the stroke risk mitigation. I did not take the farxiga, and I did not take the entresto. I still feel pretty rotten, and that's fine because these drugs will take a couple days to get out of my system. But based on what everybody has said, the entresto is probably the culprit, lowering my blood pressure, causing me to have no breath capacity. Then by removing these 2 variables, then hopefully I go from feeling awful to at least feeling what I did before the surgery, and over the next few months, starting to feel more like what I did last October. And that's, to me, very important because that's what's going to help me feel the best and enjoy the most out of every day I can. After a few days, if I am feeling better, then I will report back to the doctor to let them know that yes, I did stop taking these drugs and here's why. And I would like to just spend a month or more seeing what my body does in response to this closure device. And then if we want to talk about trying farxiga again or a substitute for the entresto, but at this point I have no desire to ever touch entresto again, which again goes back to why it's kind of annoying I spent $1,200 for these 3 medications. These are the type of decisions that you have to make on your own behalf as a patient. Now, the doctors are trying to do the best they can for you, but they can't be watching you every minute of the day. You have to be able to observe data like what I've been doing, be able to report that back and have an interactive discussion and a team effort for your health. Now, do I recommend disobeying the doctor's orders and stopping taking medications? No, I can't really say that, but I will say that, again, it's important that you observe the data and communicate that to your doctors to make sure that you're getting the best health care you can. This is also a great example of the kind of tough decisions you have to make when you get to this point in life. I have the option to keep doing what I'm doing and probably live a lot longer. But I'm making a choice to say, this length of time here, really don't care so much about that as the quality of time that I have here. And these are tough decisions to make. It's not easy to sit there and say, I'm consciously making a choice that will end my life sooner, but I'm deciding what's most important to me on my health journey. Will the drugs extend my time on this planet? Yeah, they probably would, but is it worth giving up the quality of life and the ability to do the things every day that make my life worth living? Hell no. If you haven't done so, please subscribe to the channel, click the little bell for notifications, check out the YCC merch store and see if there's anything you like, and let's live for today.